I'm Dr. Rahul Khare. I'm the owner of Innovative Express Care and also an emergency physician. I'm here really today to talk about the state of what's going on in Chicago with COVID-19, but also in preparation of our 4th of July weekend, which is very exciting. So first and foremost, our positive rates in Illinois and in Chicago are the lowest they've been since the pandemic occurred. We're at the levels of positive rates around the time of March, early March, the first week in March, and that's really great news. I think we should be very comforted by this. I will tell you, however, as other states are very red and exploding at their positivity rates, and I'm talking about Arizona as well as Texas. California is getting up there, even Washington. All of these states, it's very interesting to see what's going on. And I want to talk a little bit about that. First and foremost, Chicago had a pretty significant COVID-19 pandemic. We have to look at our graphs and see how many people were infected, how much it affected us. It was pretty significant. Now, we had enough hospital beds and ventilators, thank God and thank goodness, so thank you about that. But we did have a significant surge. We had a significant amount of deaths. And we have peaked and we've come down. And so I think we're a little bit falsely feeling better about ourselves of how well we're doing, but we have to remember how bad it was. New York is the same exact situation. They feel great right now. They're saying they're doing everything right. There's a lot of politics going on, but the truth is they were the epicenter. They had a significant amount of positives, and naturally, you do decrease your numbers. So just know that. Here's the issue. We will get a second wave. Now, whether it's as big as our first wave, or bigger, or smaller, we have to be prepared for that. So let's talk a little bit about 4th of July weekend. I think we all should enjoy ourselves. We have had a really rough spring, and we're coming into summer. But I think there's things we can do to really make sure we don't expose ourselves. So first and foremost, it's very important to wear masks, especially when you're around other people. So when you're out of your isolated group, when you're out in public where you're seeing a lot of different people, we're allowed now to go to restaurants. We're allowed to dine inside. I know it's scary, but that is allowed. I think it's very important that while you're going there, that you put masks on. While you're not eating and drinking, you should have masks on. When you're outside of that area, you should still be careful, because we are still in a pandemic, and there are parts of this country and a lot of people coming from Texas and Arizona to visit family. We are going to get we are going to get a lot of people coming to Chicago that will come from hot spots. We will see an uptick in mid-July. So just be careful. We're not out of the woods. So wear masks. I think it's very important. I was an early person to really push masks, and I still think we should do it. Secondly, if you start to feel sick, fevers, chills, cough, shortness of breath, any body aches, just low energy, get tested. It's really important to get tested. Testing is pretty easy. At Innovative, we take most insurance, and if you don't have insurance, we will cover the cost through the CARES Act. So test. It's important to know, because if you are positive, you isolate yourself and you won't get 3 or 4 more people sick. I think that's important. And third, you are going back to work later on after 4th of July weekend. A lot of places are opening up. I think it's important to push your workplace to get tested as well, because it's going to be an area where a lot of people come from different parts of this city, from different socioeconomic areas, from high positive areas in Chicago, and there are some, and it's a melting pot, and people talk to each other. You should have a plan in place of how to reduce the amount of interaction with people if possible, but most importantly, if someone tests positive, they stay home. That's the best thing we can do. So push your employer to give us a call. Go to our website. We have an occupational health area. We will even come to you if you have about 40 people where we can test people and get you results within 2 to 3 days. So I think it's really important to be testing. The tracing is going to happen. It's going to be important to do that to limit the amount of people who have been exposed and to understand the exposure and to get more testing. Um, so I think it's important to self-report to your employer when you feel feverish or chills or have body aches. So testing is very important. So that's what I wanted to tell you all. We have occupational health testing. You need to wear a mask. This 4th of July weekend, don't go to crowded bars and crowded restaurants. Try to stay home. Barbecue with your isolated friends. It's even okay to see your extended family, but limit it. You can't be isolated this entire year. The positive rates are very low in Illinois. Get prepared to have a little bump in positive rates in around 2 to 4 weeks. This is just a natural occurrence of what happens when we do a good job of containing and isolating. But the truth is, we can't stay in our houses isolated forever. Be very smart about that. And also, for those who have underlying illnesses, be very careful. You need to take this. This is people with cardiac issues, diabetes, lung issues, autoimmune disorders, asthma. You have to be careful. Think twice about going out to eat. Have the party inside where you have a limited amount of people that have been exposed. You have to use common sense. This is really important. I'm not saying everyone needs to be isolated forever. I do think, though, if you can put 6 to 10 people in your cohort together instead of going out to a restaurant where there's 50 to 100 people, or a crowded beach, or wherever you want to go, just be careful. And then have a plan with your workplace, because you can isolate yourself at home. You can do that with your friends, but as soon as you go to the workplace, you're just increasing your possibilities of getting COVID-19. So that's all I have right now. Get tested. We are open all week. We are taking a day off on 4th of July because, frankly, my employees are really tired. We're seeing over 300 patients a day, and we do appreciate everything you guys do for us, but it's time for us to get a little bit of a break. And soon we'll be expanding our hours, we'll be expanding our parking lot, we'll be expanding so that we can take care of our community and the city of Chicago. But be patient with us. We have to get leases, we got to get city licenses, we got to get all these things. Unfortunately, COVID-19 is going to be around for a while. We are going to have a second wave. My hope is that it's not as big as the first one, but we're going to start preparing for that. And we hope that the vaccine comes out as soon as possible, or some kind of treatment will come as soon as possible. So thank you guys for being a part of Innovative, for watching this. And if you have any questions, please let us know. We'd love to see you. All right, guys, be really safe on this 4th of July weekend.